His name was Walter, 69 years old, a retired high school principal from Michigan who'd spent 40 years shaping young minds and still volunteered 3 days a week tutoring kids in math. He came to me not because he was sick, but because his wife had finally insisted. Walter had been losing weight, not a lot, about 12 pounds over 6 months. He told everyone he was finally eating better. He'd cut out his nightly bowl of ice cream. He was walking more. The weight loss seemed like a victory. His primary care doctor had even congratulated him at his last physical. But his wife noticed something else. Walter was tired. Not exhausted, just quietly, persistently tired in a way he'd never been before. He'd stopped reaching for second helpings at dinner. He'd started napping in the afternoon. Small things, easy to dismiss, easy to call just getting older. By the time Walter sat across from me, the diagnosis had already been made by his oncologist. Stage 3, pancreatic. And here's the part that still bothers me, even after 20-some years of standing at operating tables. The warning signs had been there for over a year. Quiet, dismissed, misread. By the end of this video, you'll never dismiss a small symptom the same way again. I'm Dr. William Cooper. For more than 20 years, I've stood at the operating table as a cardiothoracic surgeon, with my hands inside the human chest, repairing arteries, replacing valves, and yes, removing tumors from lungs and esophagus and the tissues around the heart. And in those 2 decades, I've learned something that most physicians will never say out loud in a 15-minute office visit. After 60, cancer rarely announces itself with drama. It whispers. It hides behind symptoms you've been trained to ignore. It mimics the ordinary aches of aging so perfectly that even good doctors miss it, until it's too far along to treat with the tools we have. After 60, the rules of vigilance change. What you would have brushed off at 40, you cannot afford to brush off now. I'm not here to make you afraid. I'm here to make you informed. So let me ask you something. Have you ever wondered why cancer rates climb so sharply after 60? Why a disease that's relatively uncommon in your 30s becomes the second leading cause of death in your 70s? Here's what's actually happening inside your body. Think of your cells like a vast library of books. Every time a cell divides, it photocopies its entire library, billions of pages of DNA. For the first 60 years of your life, your body has an extraordinary editorial team that catches the typos. Tiny errors get found, damaged copies get destroyed, the library stays clean. But after 60, that editorial team starts retiring. Your immune surveillance, the patrol that finds and eliminates abnormal cells, declines. Your DNA repair mechanisms slow down. Cellular senescence builds up. And the cumulative damage from decades of sun, smoke, stress, processed foods, and ordinary metabolic wear and tear suddenly has fewer defenders standing in its way. The villain here has a name: immunosenescence, the aging of the immune system. Combined with declining DNA repair, it creates a window of vulnerability that the human body simply did not face in earlier decades. According to the National Cancer Institute, the median age at cancer diagnosis in the United States is 66, not 46, not 56, 66. Now, I'm not telling you this to frighten you. I'm telling you because early detection changes everything. Cancer caught at stage 1 is often a curable disease. Cancer caught at stage 4 is often a different conversation entirely. Your job, your only job, is to notice the whispers before they become shouts. Let's get into the 7 warning signs. Pay close attention, because at least one of these has probably happened to you or someone you love in the last year, and the temptation to dismiss it is enormous. Warning sign number 1, unexplained weight loss. I know what you're thinking. Dr. Cooper, weight loss is what every doctor tells us we need. And for most people, intentional weight loss is a wonderful thing. But here's what nobody tells you. Unintentional weight loss after 60, losing 5% or more of your body weight over 6 to 12 months without trying, is one of the most concerning early signals in all of cancer medicine. Here's the mechanism. Cancer cells are metabolically aggressive. They burn through calories at a much higher rate than normal cells, even when they're small and undetectable on routine imaging. They also produce inflammatory signaling molecules called cytokines, particularly one called TNF-alpha, which suppress appetite and accelerate muscle breakdown. The cancer is essentially stealing your body's fuel while telling your brain you're not hungry. A landmark study published in the Journal of General Internal Medicine found that adults over 60 who experienced unexplained weight loss had a cancer diagnosis rate ranging from 6 to 38% within the following year, depending on the population studied. The most commonly identified cancers were gastrointestinal, pancreatic, stomach, colorectal, and esophageal. The fix is not a fix, it's a flag. Without trying, do not celebrate. Investigate. Ask your doctor specifically for a comprehensive metabolic panel, a CBC, fecal occult blood testing, and consider imaging if other red flags are present. Tell your doctor in plain language, "This weight loss is not intentional. I want to know why." When was the last time you stepped on a scale and noticed a drop you couldn't quite explain? Warning sign number 2, persistent fatigue that rest doesn't fix. After 60, almost everyone tells me they're a little tired. That's normal. That's life. But there's a specific kind of fatigue I want you to learn to recognize. It's not the tiredness that comes from a busy day or a poor night's sleep. It's a heavy, settled exhaustion that doesn't lift after a full night in bed, a quiet weekend, or even a vacation. Here's what nobody tells you. This kind of fatigue is often the body's response to a hidden inflammatory or metabolic burden, and cancer is one of the leading causes. Tumors release inflammatory cytokines that affect your central nervous system, disrupt your sleep architecture, suppress your bone marrow, and cause anemia by reducing red blood cell production or causing slow, invisible bleeding into the gut. A 2019 review in the journal Cancer Medicine identified persistent fatigue as one of the 3 most common presenting symptoms in adults over 60 who were later diagnosed with colorectal cancer, lymphoma, leukemia, and lung cancer. In many cases, the fatigue had been present for 6 months or longer before any other symptom appeared. The fix is investigation, not supplementation. If you've been tired for more than a month and rest doesn't help, ask your doctor to check 3 specific things: a complete blood count to look for anemia, ferritin to check your iron stores, and a CRP or SED rate to measure inflammation. Do not let anyone tell you it's just stress or just getting older without checking these basics. When was the last time your fatigue lifted after a long weekend? Or has it been quietly hanging on for months? Warning sign number 3, a change in bowel or bladder habits. This is the sign people avoid talking about with their doctors. It's awkward, it feels private, so patients quietly suffer for months, sometimes years, with changes they don't want to discuss. And in oncology, that silence has cost more lives than I can count. Here's what nobody tells you. After 60, any persistent change in bowel habits that lasts more than 3 weeks deserves medical attention. New constipation, new diarrhea, stools that have become noticeably thinner, what we call pencil stools, blood in the toilet bowl, even if it's only once, a sensation of incomplete emptying, increased urinary frequency, difficulty starting urination, waking 3 or 4 times a night to go. The mechanism varies by cancer type. Colorectal tumors physically narrow the colon and cause changes in stool shape and frequency. Prostate cancer can compress the urethra. Bladder cancer often causes blood in the urine that comes and goes. And people convince themselves it was nothing because it disappeared the next day. It wasn't nothing. According to the American Cancer Society, colorectal cancer is the 3rd most diagnosed cancer in adults over 60, and prostate cancer is the most common cancer in men over 65. Both are highly treatable when caught early, and both are routinely missed because patients delay reporting symptoms by an average of 3 to 6 months. The fix: get screened on schedule. Colonoscopy every 10 years starting at 45, more often if you have risk factors. PSA testing discussion for men. Urinalysis at every annual physical. And here's the most important thing. If you see blood, even once, even a small amount, even if you think it's a hemorrhoid, tell your doctor. Embarrassment is not worth your life. When was the last time you actually looked at what your body produced in the toilet? Or do you flush without ever glancing? Warning sign number 4, a persistent cough or hoarseness that won't quit. You've had a cold. You've recovered. But the cough hung on. 3 weeks, 6 weeks, 8 weeks. You blame the dry air. You blame the dog. You blame the medication you switched. You buy another bottle of cough syrup and tell yourself it'll pass. Here's what nobody tells you. After 60, any cough lasting more than 8 weeks is considered chronic, and chronic cough is one of the most consistent early signals of lung cancer, esophageal cancer, and certain head and neck cancers. Hoarseness that lasts more than 3 weeks can be the first sign of laryngeal cancer or a tumor pressing on the recurrent laryngeal nerve, which controls your vocal cords. The mechanism is straightforward. Tumors in the airways irritate sensitive nerve endings, causing chronic cough. Tumors in the esophagus or upper chest can press on the vagus nerve or laryngeal nerve, causing voice changes. And here's the part most people don't realize. These symptoms often appear before the cancer is large enough to see on a routine chest X-ray. By the time it shows up clearly on a film, the disease has progressed. The American Lung Association reports that the 5-year survival rate for lung cancer caught at stage 1 is roughly 65%. The 5-year survival rate at stage 4 drops below 8%. The difference between those two numbers for many patients comes down to whether they investigated a lingering cough in week 3 or week 30. The fix. If a cough lasts more than 3 weeks, ask for a chest x-ray. If it lasts more than 6 to 8 weeks, especially if you have any smoking history, current or distant, ask specifically for a low-dose CT scan of the chest. This is now recommended by the U.S. Preventive Services Task Force for adults aged 50 to 80 with a 20-pack year smoking history. Hoarseness lasting more than 3 weeks warrants a referral to an ear, nose, and throat specialist for laryngoscopy. When did your last lingering cough actually go away? Or are you still telling yourself it will? Warning sign number 5. A sore, lump, or skin change that doesn't heal. This is the one that lives in plain sight. On your arm, on your face, on your back where you can't see it. A spot that's new, a spot that's changed, a sore that should have healed weeks ago but hasn't, a mole that's grown, darkened, or developed an irregular edge. Here's what nobody tells you. After 60, your skin is the largest organ in your body and the one most exposed to decades of cumulative sun damage. Cumulative, meaning every sunburn you got as a teenager, every summer at the beach, every afternoon on the golf course, all of it is still written into your DNA. And after 60, those past exposures finally start showing up. The 3 main skin cancers are basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal and squamous cell are usually slow-growing and very treatable when caught early. Melanoma is the dangerous one. It can spread fast, and it can hide in places you'd never expect. The soles of your feet, between your toes, under your fingernails, on your scalp under your hair. Here's the simple ABCDE rule for moles. A for asymmetry. One half doesn't match the other. B for border. Edges that are ragged, blurred, or irregular. C for color. Multiple colors in one spot or recent darkening. D for diameter. Larger than a pencil eraser. E for evolving. Any change in size, shape, color, or texture. The Skin Cancer Foundation reports that 1 in 5 Americans will develop skin cancer by age 70, and melanoma diagnoses in adults over 65 have been rising for over 2 decades. The fix. Do a full-body skin check every month at home, ideally with a partner who can see the spots you can't. Schedule a full-body skin exam with a dermatologist every year after 60, every 6 months if you have significant sun damage history. And any sore that doesn't heal within 3 weeks, anywhere on your body, including inside your mouth, needs to be evaluated. When was the last time anyone actually looked at your back, your scalp, or the soles of your feet? Warning sign number 6. Unusual bleeding or bruising. This is one of the most quietly overlooked warning signs in all of cancer medicine. Bleeding that doesn't fit a clear cause. Bruising that appears without injury. Gums that bleed when you brush even though you haven't changed toothpaste. Nosebleeds that have become more frequent. Heavier than expected bleeding after a small cut. Here's what nobody tells you. Your blood cells are produced in your bone marrow, and several cancers, including leukemia, multiple myeloma, and lymphoma, begin silently in the bone marrow before any other symptom appears. As cancerous cells crowd out normal blood cell production, your platelet count drops. Platelets are the tiny clotting cells that stop bleeding. When they fall, you bruise easily, bleed easily, and recover more slowly. There are other patterns to recognize. Postmenopausal vaginal bleeding, any bleeding after menopause, is never normal and must be evaluated immediately to rule out uterine cancer. Blood in the urine, even microscopic, can be the first sign of bladder or kidney cancer. Coughing up even a small amount of blood demands immediate evaluation. A study in the British Journal of General Practice found that adults over 60 presenting with unexplained bruising had a measurable increase in blood cancer diagnoses on follow-up testing, and that simple blood work would have caught the majority of these cases months before symptoms became severe. The fix is a complete blood count, a CBC, once a year as part of your annual physical. It is one of the cheapest, fastest, and most informative tests in modern medicine. It can detect anemia, abnormal platelet counts, and abnormal white blood cell patterns that flag the earliest stages of blood cancers. If anything is off, you and your doctor will know to look deeper. When did you last actually review your CBC results with your doctor? Or just hear the word normal and move on? Warning sign number 7, and this is the one that Walter had, the one I want every adult over 60 to memorize. New or worsening abdominal discomfort, fullness, or bloating. Remember Walter, the retired principal? Here's what we eventually learned. For nearly a year, he'd been telling his wife he felt full faster at dinner. He'd been quietly skipping dessert. He'd had a vague, dull ache in his upper abdomen, not painful enough to mention, but persistent enough to remember. 3 separate visits to his primary doctor produced 3 different theories: acid reflux, irritable bowel, anxiety. He was prescribed antacids. He never had an abdominal scan. Here's what nobody tells you. After 60, persistent abdominal symptoms, new bloating, early satiety meaning you feel full after just a few bites, vague upper or middle abdominal discomfort, or unexplained changes in digestion are among the most consistent early signals of pancreatic, ovarian, stomach, and liver cancers. These tumors grow in areas with very few pain-sensitive nerves, which is why they whisper instead of shout. They produce vague symptoms that mimic everyday digestive issues, until they don't. The mechanism varies. Pancreatic tumors can press on the bile duct, the stomach, or surrounding nerves, causing dull mid-back or upper abdominal pain. Ovarian tumors expand quietly in the pelvic cavity until they cause bloating and pelvic pressure. Stomach cancers cause early fullness as the stomach loses elasticity. And because the abdomen has so much room for tumors to grow before they cause obvious pain, these cancers are often diagnosed late. The American Cancer Society reports that pancreatic cancer has a 5-year survival rate of only 13% overall, but jumps to nearly 44% when caught at the localized stage. The window to catch it is small, and it almost always opens with vague symptoms that get dismissed. The fix: take new, persistent abdominal symptoms seriously. If bloating, fullness, or vague discomfort has lasted more than 3 weeks, ask your doctor specifically for an abdominal ultrasound or CT scan. For women, a pelvic ultrasound and a CA-125 blood test can help screen for ovarian cancer. And insist, politely but firmly, on imaging if symptoms persist despite treatment for reflux or IBS. You are allowed to ask for a clearer answer. So tell me, when was the last time you mentioned a vague stomach symptom to your doctor? Or did you decide it wasn't worth the visit? Let me step back for a moment. Look at all 7 warning signs: weight loss, fatigue, bowel and bladder changes, persistent cough, skin changes, unusual bleeding, abdominal discomfort. 7 completely different signs in 7 different systems. But here's what I want you to understand. They share a single thread. That thread is persistence. Every one of these signs is concerning, not because of how severe it is, but because of how long it lasts. 3 weeks, 6 weeks, 3 months. The body has an enormous capacity to absorb minor disruptions. When something doesn't resolve, it's because something is sustaining it. And after 60, that something deserves a name. When I'm in the operating room, hands inside a chest, removing a tumor that should have been caught a year earlier, and trust me, I've done this far too many times, I'm not looking at someone who is reckless. I'm looking at someone who is hopeful. Hopeful that the cough would pass. Hopeful that the weight loss was a good thing. Hopeful that the bleeding was just a hemorrhoid. Hope is a beautiful thing in life. In cancer screening, it's dangerous. But here's the truth I want you to hold on to. Most cancers, when caught early, are deeply treatable. Some are curable. Modern oncology has changed dramatically in just the last decade. Targeted therapies, immunotherapies, minimally invasive surgical techniques. Your odds today are dramatically better than your parents' or grandparents' generation faced. But all of those advances depend on one thing: early detection. Your job is not to fight cancer. Your job is to notice it, early, when the fighting is easier. Let me give you the action plan. Simple, memorable. 7 habits, 1 for each warning sign. 1. Weigh yourself once a month. If you've lost more than 10 pounds without trying in 6 months, investigate. 2. Track your energy. If fatigue lasts more than a month, get a CBC, ferritin, and CRP. 3. Pay attention to your bathroom habits. Any persistent change beyond 3 weeks deserves an appointment. 4. Any cough lasting more than 3 weeks gets a chest x-ray. 8 weeks gets a CT scan. 5. Full body skin check monthly at home, dermatologist annually after 60. 6. Annual CBC at every yearly physical, and report any unexplained bleeding or bruising. 7. Persistent abdominal discomfort or new bloating beyond 3 weeks gets imaging, not just antacids. None of this requires fancy testing. Most of it is covered by Medicare and standard insurance. None of it is hidden behind a paywall. But, and listen to me carefully, information without action is just anxiety. Don't let this video become one more thing you watched and forgot by next week. Pick one, just one. Schedule that appointment. Make that call. I want to tell you about another patient. Her name was Margaret, 67 years old, a retired nurse from Oregon, which is important because she, of all people, should have caught her own warning signs sooner. But she didn't. None of us do, when it's our own body. Margaret had noticed blood in her urine. Once. Just once. Pink-tinged, then gone the next morning. She told herself it was probably something she ate. Beets, maybe. She went on with her week. 6 months later, it happened again. And this time, something inside her, the nurse, not the patient, made her pick up the phone. She had early-stage bladder cancer, caught small, caught local. She had a minor surgical procedure, followed by surveillance cystoscopies every few months. Today, 3 years later, Margaret is cancer-free, hiking the Pacific Coast Trail with her daughter, and she tells everyone she meets the same thing. If you see blood, even once, even a little, even if it goes away, tell someone. That's the message I want you to carry from this video. You are not being paranoid. You are not wasting your doctor's time. You are not being a hypochondriac. You are being an informed adult in the most important phase of your medical life. You, watching this right now, you have a body that's giving you data every single day. Some of that data is meaningless. Some of it is profound. Your job is not to know the difference. That's your doctor's job. Your job is to report it, to bring it to the conversation, to not stay silent. After 60 is not the time to be polite about your symptoms. It is the time to be a fierce, honest, well-informed advocate for your own body. Because the body you have now is the only one you'll get for the rest of this beautiful life, and it deserves the best chance you can give it. Your symptoms are messages. The only question is whether you're going to read them. Now I want to hear from you. Out of these 7 warning signs, which one surprised you the most? Which one are you quietly recognizing in yourself or someone you love? Drop your story in the comments below. I read them. I respond when I can. And your comment might be the very thing that helps someone else in this community pick up the phone and make the call they've been avoiding. If you know someone over 60, a parent, a spouse, a sibling, a friend, a neighbor, please share this video with them. One conversation, one share, can save a life. I've seen it happen more times than I can count. If this video helped you today, hit that like button. It's a small click that tells the algorithm to show this to more people in our age group who genuinely need to hear it. And subscribe to this channel, because every week I'm pulling back the curtain on the things most doctors simply don't have time to tell you in a rushed 15-minute office visit. Everything I've shared here today is general information, not personal medical advice. Please talk to your own doctor about your specific symptoms, your screening schedule, and your risk factors. Your situation is unique, your history matters, and your physician knows you best. I'm Dr. William Cooper. Take care of your body, take care of each other, and I'll see you in the next one.